I'll just try to take you to the journey. The work that I'm presenting is all done from our lab in Kolkata, but we are kind of all working globally with our customers in USA, UK, most and Europe. So as I why we are kind of trying to take this problem is there's non-communicable diseases. I think this is a doctor community, I don't need to tell about it, that it is the non-communicable disease which is actually is the problem, not the communicable diseases. And if you take the star mark ones, the cardiovascular, the neuro, the musculoskeletal, and so on and so forth. So there are certain set of diseases which are actually becoming a big problem. And the other problem that is coming is the elderly people, and it's especially true when you go to the developed countries. There is a big problem of actually how to monitor and get them. And we had a session in the morning about that, but there are issues there. And in countries like India or any other developing country, in addition to those problems, there is also a capacity problem of what we call as the doctor per patient, or accessibility, reachability of the doctor and the patient care to the. So these are all kind of problems that we expect the IT to solve some of them as we go forward, and that is what we are trying to look at. So the point again so we call this a connected health solution, which is a next generation digital health. So instead of reaction and illness treatment, it has to move to prevention and wellness. And it's very important for the non-communicable disease, because again, when we are working very closely with a lot of doctors, and what we are understanding is the cost of care of non-communicable disease is actually inversely proportional to how early you detect it. It is a known, I think, the doctor. So that is the point actually we have to how you can actually, because people may go for a health checkup after they reach age of 50, but they may have a heart problem at 35 or 40. So if that is detected early, then if it is managed with a lifestyle change, it is a much more cheaper and a much better solution, which is a wellness driven, than actually allowing certain things to happen. But so it is going beyond EHR, EMR and telemedicine, and what we call is this Internet of Things and artificial intelligence driven screening, diagnostic and monitoring of diseases. And very interestingly, this is coming at an intersection, because I come from a computer science and engineering background, but what we are seeing is it is a kind of I would call, if you see this Venn diagram, it is a intersection of computer science, mathematics and the biological science and engineering together. So all these parties has to come together. It is not a one thing. So any problem we solve here, and the team we are seeing that we need to have a team which has engineers, which has software programmers, which has mathematicians, and which has doctors. So all of that has to come together really to solve these problems. And give some examples that. So before I move into the use cases, so this is the pyramid we actually call as any analytics. It's not a very common generic thing that we call in our IT analytics, that you get raw data, from data you get information you get knowledge, and pyramid kind of becomes more and more concise and more contextual. From there you get insights, and finally you get the wisdom. And effectively, that is what if I try to measure. So the concept is, can we get raw medical sensor data, and from there you get the signs and symptoms, which is the context part of it. Then start building models which can allow us to diagnose. Then can you predict, understand, then you can predict, you can prognose, that tell that something that's going to come. This person may develop certain condition 10 years down the line. And finally there may be a preventive care, which is a wisdom part. And as I think that morning many times that it came out, I think AI today is trying to replace the lower three layers. The wisdom will remain with human beings. That is the doctoral note. It has to be there. Even the insight part also today, there are very few systems which will be capable to do that in a given set of that. But the lower three things actually can be it can be done with artificial intelligence. And that's what I am kind of trying to look into. So there are two problems. So one part is screening for early detection of diseases. I'll take some of the examples there, where you can identify high-risk patients, and monitoring for compliance and other. So first scenario we are working is a very, I would call it a very interesting scenario, as we know that, so Parkinson is a disease which hasn't found its cure yet. And there's a lot of money and lot of investment is happening through the drug companies who are actually investing in developing new drugs. So we have this partner in Europe and USA, which is a Parkinson drug development company, who has come to us now to tell that, okay, we want to understand how the drug is actually working in real time. During a trial, clinical trial of the drug, how a patient's tremor is actually changing before and after taking the drug, how their gait is changing. Can you help us measure it? So this is the problem that we are working actually now with. It's very interesting. We are actually creating this sensors we have put in the sole of the shoe. We have put sensor on the belt. We have a smart watch like Apple Watch that person is wearing. And this is the trial that we are trying to do, which ultimately will help us to do this kind of a monitoring. It has started, so we have a tie-up with this Montreal Neurological Institute, or MNI, which is a very prominent institute in Canada, and also in India we have Sister Neural as our hospital as our partner, and we have IIT Madras as our academy. So we are kind of trying to create that ecosystem to solve this problem. And very similarly, we are able to also trying to look at a stroke and a musculoskeletal rehabilitation. Same thing, if we can actually monitor your physical movements at a centimeter level accuracy, whether I put a sensor here, whether I put a sensor in the belt, or this is a kind of a wearable sensors which people can put, and then we can actually, what it can be used in this kind of, to find out the efficacy of the drugs. It can be thought as looking at the compliance of a rehab therapy at home, like in the morning we are talking about how to take the home care, and so at home how can we actually look at that. Is a UK company startup we are working on, they are looking into that kind of a scenario. And so effectively, so how do we really do this kind of measurement? So conceptually I'm just giving the idea. So if we could actually measure this kind of things and then apply analysis on top of it, we should be able to go there. So this is, I would call this a comparatively benign mode of a monitoring kind of a use case, which we see that very soon, in 1 or 2 years, we'll see this kind of things coming into the market in a long, strong. The second one is slightly more complex, is can we actually screen people for atrial fibrillation and coronary artery disease, or IHDs, which is the heart blocks that, or arterial blocks that people have, ischemic heart diseases. So this is a problem that we are seeing all over the world, people are telling this is a big problem. That can, because these things are happening in lower and lower age today. When people actually go to the doctor, the problem has already occurred. And many times it's not a reversible thing and that kind of problem. So how do we detect this early? So there's a lot of research is going all over the world about this. So we are working on a couple of very interesting use cases. That one is a very renowned implantable cardiac device company who actually have this cardiac loop recorders, which are implanted to get your 24/7 ECG from the thing that uses as a mobile phone to send the data out. The problem is actually what you do with that data. You get that data is fine. Now what do you do with that data? So today what they have done, they have put some basic rule engines into that, which usually the doctors also put it, and what it does is tries to screen automatically. And what they do is actually they have a system where I would call it a 100% sensitivity and around 50% specificity is what they have got today. So that means they don't miss anybody who has atrial fibrillation, but all the data they sent out, almost half of them actually are from a normal people. So now they have to put a set of doctors in the cloud to actually look into that, and they get 5,000 ECG records a day. For each record, they pay the doctor $150. Now can you imagine the cost? So now they want us to actually, can I use AI to make that 50%, 80%. Even if we can make that, it is a huge value. Because now the doctors can actually be seeing more, I would call, but actually that wisdom part. There are many waveforms actually can be looked at, very simple machines can actually classify it. So we are working in that kind of a scenario. So, and again, we actually participated in a global challenge last year, which is called the PhysioNet Challenge, and which is organized by MIT. And they collect data from all the hospitals. They collected data from around 8,000 patients. They hide 2,000 data. These are all challenges about AI, what AI can do. They hide 2,000 patient data. 6,000 patient data they will annotate with doctors. Actually 5 to 10 doctors annotate, give it out. So you are supposed to build your models, AI models using those 6,000 data. That model you have to submit. And it will be run on the hidden data. And that they will test, and based on that they will put it. So fortunately or luckily we came first last year. And that is the algorithm we are now going to put in this loop recorder. So that is how it is going to come in. So, but I'm just telling the possibility of what AI can do today. And it is not magic. It is about, let me put it this way, is today suppose I ask a very complex logical question to anybody today here, they'll be able to answer it. Because our human beings are very well to reason. Suppose then I ask anybody here, so multiply a 13-digit number with a 12-digit number. We will not be able to. A calculator will do it in 1 second. So you have to understand what a machine can do good, what a human being can do. The kind of problems that AI we are going to pick up is actually the things that are actually very compute intensive. And like now, it is a kind of, we call this something like a finding needle in a haystack. So we have to find very telltale patterns of certain things in this waveform, which sometimes a human eye may miss, or a machine may pick it up. So those are the kind of things that may come here. And a version of the thing also we are going to working on, we are creating a watch now. We are creating a smart watch. You have seen the Apple Watch, many of you, but we are creating a very low cost watch of that, which may be for India, where a similar kind of a thing using the watch itself, we should be able to give an early warning for the atrial fibrillation. And then third version, we are also working on certain other devices which we should be able to use the photoplethysmogram, ECG and the heart sound together to predict early heart attacks. We have already worked with Fortis Hospital in here. So there, Dr. Mandana, who was one of the, I think, of this heart transplant team in Fortis. So he is a big champion for our area. He helps us a lot. So we did a 200 patient trial there and we are able to getting good results there. So we are trying to put into that. And the third thing we are also doing is in Singapore, which is an elderly care site, which is again a different kind of a problem, but it's a monitoring problem of, because Singapore this year, it is very interestingly Singapore, in the seen that graph, there's the inflection point, where number of elderly above 65 became more than the number of children below 15 in Singapore. So it is an inflection. Every country will reach it at some point, but Singapore reached it earlier. Because the moment you do this, from this time onwards, automated elderly care becomes a necessity. It is no more a choice, because you have less people to care than take care for. It is a reality, so it is going to happen. So Singapore, we added up 100 homes. It's a government-funded project. They are doing a pilot now, where elderly people are living alone. And this system actually has sensors and it can monitor, if they are monitoring people, if they are not moving or they are falling down or some other issues have happened, immediately alert goes and there is a caregiver who comes to the home in 10 minutes. So it's a live system there. So we are kind of piloting it now and we are seeing what more additional value that can be brought. So we are trying to do more of the other things there. So I'll just end with this so what is the future? So we use this term, you will see digital twin is the new term that is coming in the IT industry everywhere. I'll create a digital twin of a boiler, I create a digital twin of a machine. The next part is a digital twin of the human body. It is coming, that is where I think the science and the doctor and the computing engineer, all this is coming together. Can we actually create a computer model of the different parts of the human body, which given a set of signals or signs that we can measure, can it actually understand what is happening inside? That is the next job that is, so it can actually be able to, so this kind of models slowly are coming up. I don't know how many have heard, there is a project called Human Brain where people are trying to do a computation model of the brain. There is a project called Human Heart where people are, so there is a lot of work that is going on. So we are also started investing into this, and this, because again, when you do this, this model will be different for every country, every demographic. So even if somebody is doing it for Europe, somebody has to do it for India. And India, then you need to collect data and do those things. So there are multiple things that's going to happen. So I'll just skip. So ultimately, effectively, what we see is that, okay, there is a core technology, but ultimately there are 5 stakeholders here: the hospital, insurance, pharma companies, medical tech companies, and the device OEMs. We are working with all of them, but ultimately the final beneficiary has to be going to the physician, patient, and the government. But we work through this in between partner because we are ultimately a technology company. And so with that, I'll end with just 2 points that, which I would call as a word of caution, that these are all good, but the more technically, I think we see that we are going to reach there in 2-3 years. It is going to be coming. Whether we to go there, some other company, everybody will be reaching and creating niche solutions for different part of the market. But the issues are actually what I wrote in the right side of this. So we have to be very careful how do we look at the privacy aspect of it. Because moment you start identifying, that I don't know whether the car companies are thinking of actually using ECG as a biometric for the car. So car will start only when you put your steering, because everybody's ECG has its own pattern. So it's good. The bad part is that means even if you de-identify, in medical term, even if you de-identify the data and give it to that, your ECG may have a pattern which is very unique to you and it can be identified. So the privacy issues are important. There are liability issues. No AI algorithm will be perfect. 90% accuracy, 95% accuracy. So who takes responsibility for the rest 5%? And that is where I think what Dr. Devishri told in the morning, very important. That is where the doctor has to come in. The doctor will be actually using the wisdom to take care of that scenario. And finally, the third one is a very interesting topic. I just heard in one of the MIT conferences, they are telling this will be the biggest problem in future. You don't realize it now. It is about, now we are going to use machines to help us. Up till today, we have used machines which are very, very predictable. When you use the TV remote in your home, channel up means channel up. We never go channel down. If you press accelerator in your car, it will always accelerate. Brake means it will brake. If it is malfunction, it's a different thing, but it behaves in a predictable way. AI-driven system will not behave in a predictable way. That 5% will always be unpredictable. So they are predicting that there will be a lack of trust from humans to machines, which we have. Today we trust machines. We mistrust people, that's what we are doing. We mistrust human beings, but we trust machines. That equation is going to change. When that changes, many things will change. And what will happen, nobody knows, but they are telling these are the bigger problems than the actual technology problems which we have to look into. So with that, I'll end. Thank you.